Dr. Sarah Moyer is actually the guest of our wonderful broadcast today, and I'm not quite sure why Jared is featured on there, but Dr. Moyer, talk to us.
I can say something, so it goes back to me. Thanks for having me.
Back up there. That was Riot Heart Media's logo. It's so nice, but this is a 502 Live Streamers, Riot Heart, Take It From Tara, conglomerate press conference for the purposes of using me as a shining example of what to do when you get a COVID positive test. And Dr. Moyer's, honestly, Dr. Moyer, you have had a job that nobody else would want to have for the last year, and you've done it magnificently, and I just want to congratulate you on that. So thank you.
Thank you. And I probably would agree with that statement there. Anybody wants to trade with me, let me know.
I think one of the real issues is people are not getting tested enough, and therefore you don't know if you've got it. And the reason that I found out I had COVID is because I've been testing every Friday before I come to the press conference at the KFEC. So I knew that I'd been exposed between the last Friday and the Friday that I tested positive. Got my test results on Sunday, actually, and now it's Tuesday. So I'm literally 5 days into the quarantine period. And I don't know whether it was a false positive, so I went and got a second test, and I'm waiting for the results of that. But in the meantime, you guys have all told us you can't be out. You got a positive test, you just can't be out. You got to stay inside, you got to mask up. And here I am with, all my masks on because the dogs can catch COVID now, which is kind of scary. So just talk to us a bit, just reflect with us a bit about the importance of adhering to these guidelines.
No, I think you're speaking to it. So COVID it's a respiratory illness that they think about 40% of the cases are either asymptomatic or pre-symptomatic, so they don't realize they have it when they spread it.
Right.
And so exactly your case just speaks to the importance of why we want people to be screening on a regular basis if they are out in the community. And so you doing media events, that's a perfect example of how your work takes you out in the community and you're not able to stay home and isolate. And so that's exactly what I want, is people like you getting tested on a weekly basis, just to make sure that they're not one of those asymptomatic or pre-symptomatic, meaning a couple days from now you might get symptoms, but you are contagious before those symptoms start.
That's the scary part, is I don't have any symptoms whatsoever. I don't have any of the feelings that people have described as having COVID. And then there are those who say, well, give it a few days, because you just described what pre-symptomatic means. So if for instance, if I get a test tomorrow that says that second test is negative, does that automatically mean the first test was a false positive, or does it mean I may have just had a really short course of COVID myself?
Yeah, so the test looks for like an amount of the virus in there, and when it gets above a certain level, it comes back positive. And so there are very few false positive tests if you got the nasal swab one that takes a couple days to come back. That's right. If that next test is negative, would still assume the first test was positive, and you still have to wait 10 days until you're free to go back out into life. I think we're seeing more and more cases that have no symptoms or less symptoms because of the great mask wearing people are doing. Wearing that mask and following those protocols means you get less exposed to the number of particles of the virus. So your viral load exposure is less, which then translates into less symptoms, less severe cases of COVID. So to me, you not being symptomatic or maybe just feeling a little bit tired or something just tells me that you are a really good patient following the advice wearing the mask. I
have been. The very first day when we went after the scam testers down at Shorty's on 18th and Broadway, I remember David James saying to me, do you have an N95 mask? And I said, yeah, at home. And he goes, go get it and put it on. And that was in, I don't know when, March, April of last year. So, I've been double masking the last month, and started to test on a weekly basis when somebody said, we need to get people testing weekly. The biggest complaint that I hear from people is that they don't want to be quarantined. And I crack up because I think, well, if you get the virus, that's kind of like the whole point, is that we're supposed to protect each other by not being out, not going to the grocery, not going to the post office, staying in.
Right. So we really, as a society, have two options. We could all be in quarantine together, kind of like how we were back in March, none of us able to leave. Or doing what you do is we know where the virus is. And that means everyone getting tested on a weekly basis. We know who's positive. We know they're staying home. And then we know everyone that they've had contacts with are also staying home. So everyone you mentioned, your coworkers and friends that maybe were in the car with you, now we know that they have a chance of coming down with COVID. If we can get them staying home in the days that they're the most contagious, which we think people are the most contagious about 2 days before they start to have symptoms, and then 5 days after their symptoms start. And so that's why we try to catch, we have you help us identify who your contacts are so they're home. So when they develop symptoms, it stops the spread there. Like they're not then transmitting it to 5 other people. And that's the importance of the isolation and the quarantine.
Well, and when I got the test, it was Friday. I knew I had tested negative the Friday before. So I literally went through my phone and I exchanged, information with every person I had texted, every person I had seen, every person I had a meeting with, an appointment with, covered the press conference with, whatever. And then I posted it on Facebook. And I know that people have been reluctant to post that they have contracted COVID because there's some sort of weird stigma that they think is going to be, held against them. My God, we can't help it. It's a pandemic, no matter how careful you are. And I've been really, really careful. And I even got some negative comments like, blaming, shaming kind of comments, which is preposterous because it can come from anywhere.
Right. I mean, no one's safe. And like you said, I mean, you took all the precautions, but you're still out in the community. And so we know what's out there. We know that 6 feet rule and that masking help a lot. And it worked for you, I would say, because you're not symptomatic and really sick. You're not in the hospital right now. And hopefully that stays the course for your whole course of the disease. And that's our goal, is that we're hoping that we're trying to prevent severe illness and death. And so you're just a great example of how those things work.
Putting it on Facebook, it has its ups and it has its downs. I mean, it definitely notifies people, because I saw the couple of people going, oh, crap. I hugged you when you told me your dog had just died. When you're outdoors, you're masked up, you're not touching skin. Are people who actually, in that particular case, would give you like a jacket to jacket shoulder bump or, elbow bumps, which used to be so popular at the beginning and pretty much have been done away with too. Is that considered exposure?
That's not considered a high risk close contact. If you just had if you were assuming you're a mask, if you weren't masked and you were skin to skin, then that's a different story. But just that quick bump, I would say that's not high risk. I would still, like you did, notify your friends so they could be watching for symptoms, but the health department won't make them sign papers and stay home. I mean, but it is case to case dependent. So I know the contact tracers, the disease investigators probably talked through that and then contacted the people that they considered high risk. So just knowing all those details, I'm a little hesitant to say they're not a close contact if someone has the same situation and then they have to go into isolation. But majority of the cases, that quick exposure is not high risk. Yeah.
Dr. Moyer, talk to us about the job that you have to convince people to get vaccinated. And that's what we do to support you every Friday. I can't do it this Friday, obviously, but I can live stream from the fairgrounds. Talk to us about your job of convincing people of the importance of vaccination and testing and mask wearing. You've got to be exhausted.
It's definitely an uphill battle. I mean, I would say vaccination's been a kind of a relief in a way. I know when we started talking about the vaccine last fall, we thought 30% of the population would be interested in vaccination, and it's up to close to 70% now. And we're seeing that here in Jefferson County. There are certain pockets, I think, where people are hesitant or maybe had some bad information or just needed more information to help make that decision. But overall, I probably get more emails about people angry that they can't get it quick enough than trying to convince people the importance of getting it. I think the slow rollout probably helped with that. If something's a scarcity, it makes people want it more. But there still are pockets of people that are hesitant. And most of the time I found talking on them one-on-one, they just don't have the same information that maybe the studies that I've read or something like that. So just kind of talking through what they're hesitant about. I found most people agree to take it when it's their turn.
That's fantastic. And, I've been spreading our Every Friday presser to all of the community groups, disseminating it into the groups that people are reading, about their lost dogs and stuff, just because I think it's important to get that in there at a very grassroots level. Talk to me about what kind of movement forward you guys are doing to take Louvax, which is the giant facility at Broadbent Arena that is now vaccinating thousands of people a day. Talk to us about the process of moving that into the more mobile community units where you can go to the people instead of making the people come to you.
That's right. So Louvax was set up to get mass numbers through. Most of the groups that we're doing through there are employer-based. So right now it's teachers that are going through. We did first responders, healthcare workers by employer site. And so we can get a high volume of people through there quickly that want to get vaccinated. There are definitely groups of people that's not an ideal situation for, whether it's transportation or they need to talk to their physician and make sure the vaccine's right for them. They have a lot of questions. And so we've got a lot of partnerships in the community that we're working on to make sure we're also bringing the vaccine to people. Great relationship with U of L and Norton that are really helping us with these partnerships here. So good. I know both Norton and U of L, starting this week, are taking their vaccinations on the road and are helping us with starting with a few churches in the community that are in zip codes that have had a higher burden of disease or are not saying yes to mass vaccination elsewhere. So that is starting, and then also some senior facilities as well. So they qualify for that older than 70 group, but didn't qualify for the federal program where CVS and Walgreens went out to the registered or certified, I don't know what the right term is, the nursing homes to do vaccination. There's a gap of places where there's older people that live, but not necessarily nursing home status. So working with Walgreens and U of L to help with those sites as well.
That's fantastic. Dr. Moyer, I cover the protests that have been going on in the last 10 months in the city, coming up here on a year since the murder of Breonna Taylor. And I know that there is great hesitance in the Black community, and it's not just in Louisville, it's nationwide, because many Black folk were used as vaccination guinea pigs, literally. Horrible things were done, experimentations. You go back into the World War, into what was done, to the Jewish prisoners. I mean, there's always been a group of people that have had to take literally the first shots or whatever. I know there's a lot of hesitation. There may be some fear, and you've been working with folks who are leaders in the Black community to actually get them to understand the importance of taking the vaccinations and knowing that the reason why is not because they're the guinea pigs, it's because they're disproportionately affected by COVID. Talk about that just a bit.
Yeah, that's true. I mean, if you don't trust government, you don't trust the medical system, you're not going to trust what I say. So working with other community partners to get the information out themselves on why they chose to get vaccinated, why it was important to them, the studies that they read to feel comfortable, and have them be the messenger for me and for us at the government, and why it's important that they do get vaccinated. And so that's been really helpful. So just knowing who are key leaders in the community and having them help has been, it's just a great thing about Louisville, I think, in general, is our collaboration and partnerships across the board. And so just lucky again that we have that. And we just released our vaccine demographic data today on our dashboard. So something to take a look at. Yes. And it's paying off. I mean, the non-white population that we've vaccinated, I think it's about 17%, which still is not the 21% that we know or that our non-white population is, but it is still less of a disparity than I think other cities have seen. And I think that's good, because of the work that you all are doing and others are doing to get the word out about the importance of vaccination.
Yeah, we definitely want to get the word out. And we continue to say mask, social distance, sanitize your hands. But now the fourth very big component, which is vaccinate. There are a lot of folks concerned that they have not been able to get vaccinated, and they may feel like they should have been. Just describe for us the process of realizing why vaccinations have to be administered in a certain way.
That is a great question. So vaccine is in very short supply right now, and it is a very fragile vaccine. I know people remember back to when we had our Hep A outbreak a few years ago, and we were able to go out to homeless shelters and homeless camps and substance use disorder treatment facilities to just vaccinate everyone there. Unfortunately, the COVID vaccine is very fragile and is not as mobile to be able to do that with. And so it requires like crazy cold temperatures for refrigeration. You have to use every dose in the vial or it has to get thrown out. And so just the logistics are a lot more challenging. So that's one hurdle that working through, which is why it's easier to bring people to us to take out some of those barriers. But we know that's not easy for everyone, so we're trying to do both. There's also the fear that if you like shake the vial too much, the vaccine can not work as well. And so still encouraging anyone who can go to a site to get vaccinated, whether that's ours or Norton or U of L or Baptist, that's still the best option. But if that's not available to you, one of these mobile sites coming to you is a really good second choice. And I lost train of thought. So you ask your question.
You did great. Riot, do you have any questions that you wanted to pop in there on? And I know Max just came on too. So you've got three live streamers going at the same time. Maxwell, feel free if you want to add in here. I do have a good question about animals though, because a lot of people are forgetting about that. We had at the very beginning of COVID, I had an interview with the National Zoo veterinarian and Dr. Jamisi from Louisville Zoo about, I think at that time it was maybe a gorilla that had gotten COVID, something. And then now the snow leopards. The snow leopards, crazy. So domesticated animals are definitely in danger of contracting COVID. And although they say most are mild cases, their body also determines the severity of the case because, I've got 2 with cancer and 1 who's a heart patient. So it's been really hard to tell Gracie she can't sleep with me as she has for the last 14 years. And it's really hard to tell Brady that he can't lie on the couch next to me. But I have to protect these guys. And so even wearing a mask in my own house is kind of crazy, but that's what you guys told me to do.
Yeah, we want your animals to stay healthy. So thank you for doing that. I mean, I think you said it right. So as far as I know, I would talk to your vet to be sure that the cases in animals tend to be milder. I do not know of any animal that has passed away from COVID, but we'll check with the vet on that one. And we haven't had any pet to human transfer. It's all been human to pet too. Right. So, but it still is a concern and something we're watching and following. But that's been how it's spread, and it's more cats than dogs too. Like cats,
isn't that interesting?
Get like the snow leopards, I think are part of the cat family. I know the tiger. In New York,
it was the tiger at the zoo, not the gorilla. It was the tiger. You're right. Mm-hmm. Yeah.
So the cat family has been catching COVID more than any other animal.
Crazy. Well, I tell you what, I just am grateful to you because I jokingly said that, when I was calling and I had friends who were trying to get unemployment, we couldn't get the state to call us back. And I've gotten a call about every hour from the health department. So you guys are on it and I'm very glad. And the next step is the contact tracing that I haven't already done by announcing it to the world. So I'm sure that when they call me, they're going to want to know everywhere I've been, everything I've done. And of course, I have already notified everybody on Facebook. But, I'm going to sit tight. And
right. So the big thing, the people that are high risk are people that you saw kind of 2 days before your positive test because you didn't have any symptoms for more than 15 minutes within 6 feet. And those people need to be staying home now because they're most likely to catch it if they were kind of between day 2 and 5. And so we want them home for ideally 14 days, but we know that's really hard with workplaces and other stuff. So monitoring for symptoms for 14 days, you can cut it down to 7 days if you test on day 5. And we say day 5 is like 5 days after the last time they saw you. So somebody saw you Friday, counting 5 days, what's that, Saturday, Sunday, Monday, Tuesday, today, or Wednesday, tomorrow, they should get tested and then still stay home. And then Friday, if that test is negative, it's okay to leave your house, but still make sure you're wearing that mask and watching for symptoms and make sure your workplace knows too, just so you're not too close to anyone. And that's how we're going to stop the spread in the community is just stopping those chains of transmission.
I think people get scared too because, I started to drive through Starbucks and I thought, I don't want to hand them my credit card. And I said, hey, I tested positive for COVID. Can I do Apple Pay? And they were like, sure, thanks for telling us. So, and I kept my window rolled up and just, held the little phone up there and scanned it. So, and then I've got my Lysol next to me and I'm spraying, it's just crazy. But you feel kind of weird that that you're hosting something that can transmit deadly viruses to others. So which, besides taking the dogs out, I'm not doing anything other than just staying inside. And it's very hard to do, but I feel like, it's the right thing to do.
It is the right thing to do. So thank you for struggling through that and getting the word out. So hopefully more people will do that now. Because, think about if you didn't get tested, you'd still be out right now spreading it and not knowing, because you wouldn't have taken that precaution to keep your window up or using Apple Pay. And that would have been one more transmission that might have happened.
Okay, so question, if you just had the COVID-19, do you still get the shot this soon? I did get the antibodies test. It is positive. Interesting. That's the question that came in. They had COVID-19. They've got a positive antibody test. How long do they wait to get their vaccination?
So we still want people to get vaccinated even if they've had COVID, especially right now. I announced this morning we had our first variant case in Jefferson County.
That's right.
So that just gives you a little bit extra protection and your body a little bit extra fighting power. You have to wait 14 days after your positive test if you're asymptomatic like you. If you ended up going to the hospital, we say 30 days. And if you got the monoclonal antibody, or BAM is another name for it, the medicine, if you're at high risk for severe complications, they would have given you that. You have to wait 90 days after that.
Wow, that's amazing. So if you have had COVID, there are restrictions. You can find all that at the LouisvilleKY.gov page, I'm sure, Dr. Moyer.
Probably, yeah. I don't know for sure, but we screen for that if you come to get tested at LouVac. So, but just know you have to at least 2 weeks after you test positive to get vaccinated.
Well, I appreciate you so much, and we will send any further questions your way by just putting them on this live stream. So if you will, just check back on the live stream, and if you see any important questions, you might just want to feel like asking Kathy, our beloved Kathy Turner, to type in some answers for you. And,
sounds great, and I'm sure she will send me.
Happy to do so. I'm happy to do so.
We appreciate you, Kathy. Thank you.
Well, thank you. Thank you for always helping us share information. I appreciate that so much. And thank you for using yourself as a shining example for everyone.
I'm trying. Thank you. Dr. Moyer, I hope things continue to be well with you and you can stay healthy and well and do your job.
Thank you. Appreciate it. I hope you have a speedy recovery. I hope you stay with no symptoms.
I feel pretty good right now, so thank you, and thanks to everybody for the uplifting prayers. And please listen to what Dr. Moyer and her staff are telling us, because it is just critical to be able to get this thing underway. And now we've got an ice storm coming in, so maybe that'll motivate people to stay home, right?
Hey, it can't hurt, right? I just hope it still lets people get vaccinated. So we're following that closely. All right, I've got to run. Thanks for having me.
God bless you, Dr. Moyer. Thank you.